Well, let's tell our audience a little bit about the specifics of what you guys do, because you're not just sending patients home with a playbook to help them adjust to leaving acute care and going home. You're actually getting diagnostic feedback, right? Can you talk a little bit about what kind of information is going back to the practitioners and how that benefits the patients and maybe the overall infection prevention outcomes?
Spot on. So for our devices that we're sending in a patient's home, that kit I was talking about, it's all customized by a patient's disease state. So a diabetic patient may have different peripherals and different education and content on our tablets than a cardiovascular patient or a cardiopulmonary patient or a new mom. It's all customized by disease state. So we have over 15 different peripherals that are available with our kits. And they will collect different vitals and biometrics along the way. And so for a hypertensive patient, it could be as simple as a scale and a BP. For a patient that may need in-home ECGs and glucometers, we can accompany that kit with that as well. And essentially, as a patient were to use the technology, and it could be the vital and biometric technology, it could be the symptom surveys, it could be the mental and behavioral health content. As they engage with the technology overall, all that data is aggregated, synthesized, trended, and then sent back to the clinical teams. And so the clinical teams on the other side can see the trends and see the data in real time. And then the system is smart enough to be able to tell the patient, or I'm sorry, to tell the clinician, if they have 100 patients, which ones to focus on and why. So perhaps they've missed their medications 3 days in a row. That's a big issue. Perhaps they haven't weighed themselves in their CHF patient and they have to do that. And so we'll actually tell them and alert them which patients to focus on and why they should do that. One of the really nice things, and one of the things we spent so much time on during COVID is making sure that we can involve different care teams. Folks were so busy from the clinical perspective and still are, that it's not always a luxury to have somebody just sitting there and monitoring things. So what we wanted to be able to do is perhaps that patient who's Dr. ABC's patient, maybe they get routed over that physician, whereas a patient who has a care team somewhere else can get routed one way as well. So it's really not only about ensuring there's connectivity with the care team and the patient, but also ensuring that there's convenience in the clinical workflows that are there.